Tonsillitis. Tonsillitis is inflammation of the tonsils, two oval-shaped pads of tissue at the back of the throat, one tonsil on each side. Cause of tonsillitis. Tonsillitis is most often caused by common viruses, but bacterial infections also can be the cause. The most common bacterium causing tonsillitis is Streptococcus pyogenes, group A Streptococcus, the bacterium that causes strep throat. Other strains of strep and other bacteria also may cause tonsillitis. Diagnosis. Examine throat to reach a diagnosis. Take a throat culture by gently swabbing the back of your thrower. Blood for a complete blood count. This test can show whether your infection is viral or bacterial, which may affect your treatment options. Symptoms. A very sore throat. Difficulty or pain while swallowing. A scratchy-sounding voice. Bad breath. Fever. Chills. Earache. Stomachache. Headache. A stiff neck. Jaw and neck tenderness from swollen lymph nodes. Tonsils that appear red and swollen. Tonsils that have white or yellow spots. In very young children, you may also notice increased irritability, poor appetite, or excessive drooling. Treatments for tonsillitis. Treatment for tonsillitis depends on the cause. If the cause is a virus, there is no medicine to treat it. If the cause is a bacterial infection, such as strep throat, you will need to take antibiotics. It is important for you to finish the antibiotics you feel better. If treatment stops too soon, some bacteria may survive and reinfect you. Gets a lot of rest. Drinks plenty of fluids. Tries eating soft foods if it hurts to swallow. Tries eating warm liquids or cold foods like popsicles to soothe the throat. Isn't around cigarette smoke or do anything else that could irritate the throat. Sleeps in a room with a humidifier. Gargles with salt water. Sucks on a lozenge, but do not give them to children under 4, they can choke on them. Takes an over-the-counter pain reliever such as acetaminophen. Children and teenagers should not take aspirin. In some cases, your child may need a tonsillectomy. Complications. If you don't take a full course of antibiotics or the antibiotics don't kill off the bacteria, it's possible that complications could develop from tonsillitis. These include rheumatic fever and post-streptococcal glomerulonephritis, as well as obstructive sleep apnea, OSA. People who experience chronic tonsillitis may start to experience obstructive sleep apnea. This happens when the airways swell and prevent a person from sleeping well, which can lead to other medical issues without treatment. Tonsillar cellulitis.